Good.
So we're going to do C1, C2, rotary technique with a cradle grip. So table height is going to be right at belt buckle. You're going to bring him in his neck and the crown of his head right up to the edge of the table so that I can kind of get over him, where I can be a little bit more athletic with it. So JC, I'm going to be scooch up just a little. Perfect. Yep. So again, the pillow is in position specifically such that I can get underneath his neck. I'm going to first assess, and we talked about doing it with the lateral glides. And again, you want to be using your hips. I also will use a little bit of a locking technique to assess. So my finger, I come down to ensure that I'm on the right segment. I feel occiput. I drop down first spinous process. That's my C2. And then his left upper cervical is a little bit more restricted than his, well, I take that back. They're both pretty stiff. And so I first have gone through my assessment, either lateral glides or with a little bit of a locking technique. And then I'm going to go into the sequence of the manipulation, right? So let's talk about short applicator. If we're going to go to his right, then my short applicator is going to be my left hand. I'm going to start just posterior, and then I'm going to take up the soft tissue slack lateral, such that my middle digit or my middle knuckle is on the articular pillar. My hand is going to, because we're at C2, it's going to go over the ear like this, where my long lever is going to be, if this is, think about the axis of his head, it's going to be posterior to the axis such that I can add a counter rotation, and then it's all, but it's not going to be so posterior such that I can do a combined motion like that. So it's a little bit of a lateral flex and a rotation. Okay, so I get my hands, my applicators in the right place. I'm kind of in this wing nut position, and elbow out. It's going to be a high arc of rotation. So if we look at how I set up, so if you back up, you'll notice that I get my free rotation. I just roll his head about 20, maybe 30 degrees onto my long applicator, and I'm cradling that. I then get my side bend through my feet. I turn my hips, lateral glide, PA shift, and then I'm into it, right? And then it's a high arc of rotation like that. So once again, I come in, assess, I find my C0, C1. Great. Sorry, I'm doing it more intuitively. So free rotation, okay? I get my side bend, side shift, PA shift, and then I'm in a stride, powerful stance, and my long applicator is countering and complementing my short applicator. And I'm feeling a little bit of difficulty getting high onto that cervical spine. That's better. And then it would be like a quick thrust like that. Again, table height about belt buckle. Use your feet to add in your additional levers, right? And your hands can be quick, relaxed, and so they can be quick. All right. Any questions?